You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall. Welcome to the Dental Zone podcast. I'm a holistic dentist from Brisbane, Australia, and this is the show where I talk about all things dental health and overall health and well-being, help you understand what's going on in your mouth and how that impacts your overall health and well-being. Talk about why things happen, how you can prevent them, and how you can treat them. If you'd like to know more, hop on over to holisticdentistry.au or check out my dental practice website, evolvedental.com.au. Today, I want to talk to you about receding gums, why gums recede, how you can prevent them, whether you can make them grow back or not, and let's have a look at some of the myths, facts, and truths behind this. So let's get to it. Let's get in the zone. Welcome to the show. I'm going to talk about gum recession. And one of the first things I want to say is gum recession cannot be reversed. I don't care how many YouTube videos you've watched of so-called oral health experts and dentists or whatever they claim to be telling you you can grow your gums back, because the truth is you can't. Once they have receded, they have receded. But you can prevent receding gums. You can slow it down and you can stop the damage that is happening. If the signs and symptoms are caught in time, your gums can be healed, but they cannot be reversed. Damage to your gums is often irreversible, and unfortunately, gum recession is one of those cases. But if we can catch it in time, we can address the issue and we can prevent it getting worse, and we can keep things in the best health. So I'm going to talk about how your gums work, what they're for, why you have gums. I'm going to talk about some of the causes of gum recession and give you some ways in how to stop having receding gums. So your gums, or your gingivae, as they're called, gingiva, is the layer of pink tissue in your mouth, and that protects the roots of your teeth. And it also covers the bone around your teeth called the alveolar bone. And this is the bone that your teeth are in that is connected to the jaw. The gums are a protective barrier to prevent infection getting inside your body. So like your skin, your gums protect the more sensitive parts of our mouth from bacteria. The gums are made up of a moist surface layer called the mucous membrane. And then this is a dense tissue, and it has a lot of blood vessels within it. Healthy gums stop nasty molecules from getting into your bloodstream that don't belong there, but diseased gums allow these nasty, dangerous, and unsafe things through. Gum recession. So basically that's when your gums move away from your tooth and you get what we call long in the tooth. There's a number of factors that can cause gum recession, and basically it happens when your gum tissue starts to die off and your gum line shrinks higher and higher up around the tooth. Once this happens, you get small gaps or pockets that open up between the gum line and the teeth, and that allows an entryway for bacteria. Even a small eruption through the gums is dangerous, because these bacteria get beyond the barrier of the gums, and then your body has to start working harder to fight infection. It's like having a low-grade blood poisoning constantly. Now, your gums cannot heal or grow back once you've developed a receding gum line. So the best way to address gum recession is to actually prevent it before it starts. So let's look at some of the risk factors for receding gums. And I'm sorry if I burst your bubble. I'm sorry if you've watched other things or read other things that are making promises that they can, you can do this miracle thing and your gums will grow back. Well, unfortunately, it doesn't happen. So Why do bacteria eat away at your gums? What about gum disease causes recession, and how does that work over time? And what other causes of recession are there? So gums recede in many ways, and it's not always because of gum disease. So if you grind and clench your teeth, called bruxism, because you've got TMJ problems or airway problems like sleep apnea, that clenching and grinding can cause recession. Even if your gums aren't infected, you can get swelling, which is called edema, which is a swollen area of infection behind the gums, and that can cause them to swell. And that happens because there's a change in the microbiome. So gum disease causes the gums to die off. As the gum tissue dies, it shrinks. Bacteria don't actually eat away at the gum, but what happens is the tiny blood vessels in the gums get damaged. And these blood vessels are very fragile, and that's why you can get gum damage from having high blood pressure, because those blood vessels are getting injured. And so if you get problems with blood flow to those tiny vessels, the same ones like in your kidneys, then you're going to have problems, and things that can cause that are things like high blood pressure, as I've mentioned, diabetes and heart disease. So if you get gum disease, that will damage the structures around your teeth, and that will make your gums recede. Another cause of gum recession is overbrushing. If you scrub your gums too hard, it traumatizes them and damages them, and then they recede. Apparently, if you eat lots of really hard foods, that can possibly cause some recession. I'm a little bit jury out still on that one. And then there are other things that can cause recession, and more localized, and that can be things like a tongue tie or a lip tie. The main cause of gum recession is gum disease, so that's gingivitis or periodontitis. If you have any of these things on this list that I'm about to go through for you, you're at higher risk for receding gums. And I'm going to order them in descending. So the first one is the one that's most likely and most frequently to cause problems. So number one is gum disease. And your signs of that are things like bleeding gums, red gums, swollen gums, sore gums, bad breath, and infection. Then there's eating gum-damaging foods. And again, I'm a little bit jury out on that. Age, we are told we get longer in the tooth, but I think it's because as the older you get, your body's starting to break down, and those fine blood vessels are getting more fragile, and you'll end up with systemic issues that are showing as gum disease. Then you've got genetics, you've got overbrushing of your teeth, as I've mentioned, high blood pressure, diabetes, heart disease, tobacco use, smoking, poor dental hygiene, which can lead to excessive tooth decay or infection, physical trauma to the teeth and gums, changes in your hormones, and particularly for women during pregnancy and menopause, tongue tie and lip tie, and then lip or tongue piercings can also damage your gums. So what are the signs and symptoms of gum recession? Well, the official diagnosis of receding gums by your dentist is called a local mucogingival problem or gingival recession. But before your dentist measures any visible recession, are there ways to tell if your gums are receding yourself? Very early stages of gum recession usually aren't visible to the naked eye, but you may notice sudden symptoms early in the process, such as sensitivity to cold, acidic and sugary food or drinks. You may see inflamed red gums. They can appear or feel swollen and may bleed easier when you're brushing and flossing. If you don't change your habits or treat the underlying problem during these early stages, you may actually start seeing recession of your gums. The real findings come with measurements, and we measure your tooth height in millimeters. We look at the ratio of attached and unattached tissue, which means we can see where the gums still hold on and where they don't hold on. And we should notice any receding that's taking place. And this is important with older patients who are more likely to have receding gums. What then are the consequences of gum recession? Well, there's going to be the basic long-term and short-term effects. You're going to get some sensitivity, you're going to get some discomfort, but the long-term impact is more critical than that. You can have, you get gingivitis, which is the most common form of gum disease, and that happens because you get tartar and plaque and bacteria build up on your teeth. And if that isn't regularly removed by a dental professional, then you're going to experience an increase in sensitive and bleeding gums. Left unchecked, this will advance and cause the gums to pull away from the teeth, which is what we call periodontitis. At that point, root decay becomes more likely. Infection is now near a place where the enamel and dentine aren't thick and protecting nerves, and instead they're offering very little protection. The body does all it can to protect the inside of your tooth from the outside world. And this is why you get the early warning system that you're going to get sensitivity. But it's also why you get bleeding gums, because your immune system is trying to fight the disease. Now, things like gum disease, periodontitis is linked to diabetes, heart disease, stroke, premature birth, pneumonia, types of cancers, Alzheimer's, dementia. So you've got to take gum health pretty seriously. With healthy gums, it's easy to prevent tooth decay, and it's easy to prevent gum disease. You need to do this with good oral hygiene and by eating a diet that is high in nutrients, so like a paleo type diet. You need to breathe through your nose, not your mouth, and you need to make sure you're visiting the dentist regularly. As your gums recede, if you get decay on the root, it doesn't have a very long way to go before it's going to encroach and damage the nerve. And a small amount of decay on the root can mean that you require a root canal because your nerve is exposed, or you're going to end up having to have a tooth extracted and you may lose teeth. And once you lose teeth, you're going to experience worsened sensitivity, you're going to get even more recession, and you're going to get problems. So if you're getting recession, you might even need a gum graft or gum graft surgery. And this is where we take gum tissue from near the gum line and we use it to rebuild some of the gums that have died off. Gum tissue that has died can't be regrown. I'm going to say it again, you cannot regrow gums that have receded. They can only attach to where the bone is. And in gum disease, where you get periodontitis, not only does the gum peel away, but the bone gets eaten away and your gum can only stick to bone. Gum graft surgery can be a treatment for receding gums, and it can restore some of the protection your gums offer, and it can improve the way your teeth look. Rather than regrowing tissue, the surgery involves reattaching gum from other places in the mouth. Rapid gum recession can even cause bone loss. This isn't just the loss of tooth structure, but a degradation of the actual bone connected to the teeth at their root. So how do you fix receding gums? Let's have a look at some ways that you can do this. How can I do it without surgery? Well, the best way is to treat any gingivitis, periodontitis, or receding. It's to prevent it happening in the first place. After all, if you can treat things in the early stages, if you could do that at home, wouldn't that be better than progressive gum recession? Look, you're going to get some level of gum recession with age no matter what. It's going to get worse or happen sooner if you've got gum disease. If you have bruxism, which is teeth clenching or grinding, if you overbrush and scrub your teeth, or you use a hard bristled brush, if you've got defective dental work that's accumulating plaque and tartar, if you've got systemic diseases that impact your blood vessels, things like high blood pressure, diabetes, heart disease, if you've got crowded teeth, and if you smoke, these things are going to increase your risk for recession. Simply put, gum disease and grinding your teeth are the largest contributors to recession over time. Both of these are preventable, which means you would be wise to do something about it, and then that way you're not going to get long in the tooth. Here's some things that you can do to help prevent gum recession. I want you to brush properly with a high quality toothbrush. I've done some podcasts on how to do this, and I've also got some blogs on evolvedental.com.au on how to brush your teeth properly and what to use. But essentially you need a soft bristled brush, and change it out often. Change it every 1 to 2 months, or 2 to 3 months if you're using an electric one. If you brush with a hard bristled brush, that's going to give you a higher risk for receding gums because it damages the tissue. It's a little bit like taking sandpaper to your teeth. Brush gently, don't dig, don't saw at them. Use sweeping circular motions instead of back and forth sawing. Brush for at least 2 minutes in the morning and at night, and then do it during the day if you've eaten sugary, acidic or processed foods. Wait about 20 to 30 minutes before you brush after eating, and then just give them a good brush. Get rid of any of the acid, any of the sugar, and any of the bacteria that are building up. Now, if you have receding gums, I like you to use an electric toothbrush like Sonicare by Philips. Get one with the sensitive setting. You can use sensitive replacement heads. Go with the electric option. That's going to give you a really good clean without you applying tons of pressure. Be very gentle and let the brush do the work for you. Now, if you clench or grind, wear a night guard or an occlusal splint. When your dentist recommends that you need to be fitted for a night guard, the reason we do this is because we know clenching and grinding wears away your teeth, it damages your teeth, it cracks and fractures and breaks teeth and dental work, it makes your gums recede, it damages the bone around your teeth, it causes inflammation within your muscles and facial pain. It causes inflammatory damage to your jaw joint and eventually arthritis that will cause you pain and suffering long term. So a night guard is a non-invasive, relatively affordable, something that we can do that's not going to cause any irreversible impact to your teeth, and it's something that can save you a lot of anguish, pain and suffering and dental expense over the long term. So if you grind and clench your teeth and we say we want to fit you for a night guard, maybe it's worthwhile listening. It's a simple solution that can treat symptoms and help and really reduce any issues with your ongoing recession. Most people grind their teeth because there's some issues with sleep apnea, and having a night guard improves your sleep quality. It can reduce your snoring and other sleep apnea problems, and it's one of the best ways to protect yourself from gum recession. I'm also going to encourage you to stay away from acidic foods and drinks. Your enamel is quite resistant to acid, but the dentine, the covering of the roots, is not, and acid speeds up gum recession. The root can be dramatically injured in a short period of time when it's exposed to acidic things like lemon juice, citrus, sodas, wine, and other acidic substances like vinegars. You want to buffer these acids by drinking water alongside your acidic foods, and therefore you're going to help kind of dilute and wash away some of that acid. If you're going to consume acidic foods and drinks, do it in a small portion. Do it in a small portion of time. So don't be having prolonged or frequent exposures to acidic snacks and drinks. Make sure to rinse your mouth with water or drink water afterwards. If you've got gum disease, you need to treat it and prevent it. Gum disease will guarantee quick and irreversible gum recession. So you want to have good oral hygiene. Be proactive. Go to your dentist, get this treated. Brush your teeth gently morning and night. Floss. Make sure you're cleaning in between your teeth. Use a good electric toothbrush, particularly one with sonic vibrations. Deal with your teeth clenching and grinding. Eat a good nutritious diet. You might want to supplement with things like collagen and vitamin C to help support your gum health. So what happens if you've already got gingivitis or you've got gum disease as well? You want to address things like dry mouth. You want to address your diet. You want to be using a good natural mouthwash. Something with bicarb in is very good. You can do coconut oil pulling. You want to make sure you're looking after your microbiome. It's very sensitive. You don't want to be using something like Listerine. Sorry, Listerine, I'm going to give you a bad rap. That just destroys all your good bacteria, and then you're going to have problems with dry mouth, you're going to have problems with bad bacteria overgrowing, and you're much more likely to get decay and gum disease from using the wrong type of mouthwash. If you've got an infection like gingivitis, you've got to get rid of the bacteria and give your mouth a chance to heal. And the way you can do that is by rinsing with warm, salty water, oil pulling, and then diet. Things that are anti-inflammatory, things like turmeric, your good fats, krill oil, omega-3, anything that's antioxidant. These are all going to help your gums. If you are still having problems, then you must make sure you're getting regular dental care so that we can address the underlying factors. Then we're going to come back to the foods that damage your gums. You want to avoid things that are high in sugar and acid because they're going to break down the gum tissue. And then there are other things that are just kind of a little bit too hard, like popcorn, pork rinds. Then you've got your crappy foods like your processed stuff. You want to avoid that because they're unhealthy and they're going to cause problems for you as well as your gums. Always make sure you look after yourself. Avoid things like citrus, things like fermented food and drinks. Coffee's really acidic. Make sure you see your dentist. If you want to avoid gum recession, go for your 6 monthly visits. If your dentist or hygienist says you need to go more regularly, that's because they can see that you're at risk. And you've got underlying issues that may be making you more prone to gum disease. You've got to make sure your gums and teeth are cleared of tartar and plaque buildup to prevent gum disease and tooth decay. I use these visits as an opportunity to keep a measurement on your gums, to help prevent gum recession and really, really help you understand what's going on. To support you to better manage areas that you are struggling to look after as well. I want you to share your concerns. I want you to listen to what I have to say in return. If you're not happy with that, then by all means, I always encourage a second opinion. But my job is to be concerned about your welfare and to make sure we're giving you the best care. So then what are we going to do if, we find that you have receding gums? Well, what I'm going to do is I'm going to perform a deep clean and clear any bacteria from the pockets caused by the recession. So I'm going to ask and answer the question again. Can receding gums grow back? Well, no. Once they recede, you can't regrow them. The gums are not like the skin on the back of your hand that you can pick up and stretch a bit. it wouldn't be able to offer the same type of protection to your teeth if it was like that. The gums are a different kind of beast to your skin, and yes, if you cut them, they will repair. But if they have receded, they will not grow back. Now, there's gum grafts that we've talked about, but there's also a thing called pinhole surgery that can actually, it says it helps to grow gums back. I haven't seen substantial research to prove that it does work, but if I get some updates on that, then I will let you know. Extremely damaged gums, then gum graft surgery can help restore some of the lost tissue. It's not truly a reversal. It's just like putting an extra cover on. And the best way, as I've said, to treat gum recession is to stop it happening in the first place. So how do we treat it? And once it's diagnosed, the first step is we're going to do the deep cleaning. We're going to get all that bacteria out, and we're going to make sure that we get things nice and healthy again. Then it's up to you to make sure you're doing your home care to address clenching and grinding, to swap your hard toothbrushing and toothbrushing habits for ones that are more supportive. You may end up with sensitivity because of your recession, and in that case, we're going to apply desensitizing agents. We're going to be recommending hydroxyapatite, something like Grant's sensitive toothpaste that will help with those sort of things. I may recommend orthodontics to get your teeth in a better position, and sometimes that can improve the gum recession by readjusting where your gum line starts and stops. We may cosmetically camouflage it with veneers or porcelain covers. These can fill in the gum space, and they can protect the area of your teeth where the gums have receded. But you've got to make sure that your oral hygiene is good, because if we're doing that, then you've got to be able to keep things really clean. Then, like I said, we've got the gum graft surgery where we can take a bit of gum from elsewhere and we can pop that over the tooth. We can look at the pinhole surgery technique. Not really sure. It's at very early stages with that. Now, really, quite simply, the three main causes of gum disease gum recession are gum disease, overbrushing, too vigorous brushing, hard brushing, same basket, and clenching and grinding. So we need to address your gum disease, we need to make a night guard to address the clenching and grinding, and we need to change your oral hygiene habits and switch you to a nice, soft toothbrush. So brush properly, not aggressively, deal with the root cause of your teeth grinding, avoid acidic foods and drinks.